Welcome to the Modern Athenas podcast with Sonia and Debbie, where we discuss how regular women became Athenas in their own time by working hard, persevering through the challenges in their lives, and contributing to a better world. This is podcast 25. In this podcast, we will be discussing the book A Nurse's Story, Life, Death, and In Between in an Intensive Care Unit by Tilda Shalof. You can use the link on our website at modernathenas.com to order the book after the podcast. A Nurse's Story is Tilda's part memoir, part thought-provoking discussion about her life as a Canadian intensive care unit nurse and the challenges and rewards that come with the job. The book addresses many of the themes we have discussed on previous podcasts: friendship, being a new professional, emotional detachment, insecurity, connection, and compassion. The book also tells heartbreaking stories and far rarer triumphs that come with working in an ICU. Through it all, Tilda makes you feel as though you were right there with her, experiencing each moment and rehashing each hard decision and case after the patients have long since left the unit. She also describes the emotional torment that sometimes rages within her as she watches families make the decisions about their loved ones' care. Decisions that could either extend medical treatment in hope of recovery or allow the patient to pass away in as little as pain as possible. Our decision to discuss this modern Athena is not based on anything famous that she has done or any one feat that she has accomplished. Indeed, Tilda is not famous at all, and on the surface, there is nothing terribly unique or special about her. But it turns out there is. The silent professionalism, humanity, and kindness that Tilda and her fellow ICU nurses show to a patient in their darkest hours is, at its core, the greatest gift that one human being can give to another. As you read the pages of Tilda's book, you will feel humbled at the opportunity to just listen to her words, and her story is a reminder to us all that modern Athenas can be found throughout our society if you just know where to look. Tilda's choice of the nursing profession was not popular with her parents. Her father wondered if there had been another Jewish nurse. Her mother was not much more supportive. Quote, "Surely, Tilda," my mother said, "you could choose a profession that didn't involve such selfless, back-breaking labor and long hours for such meager remuneration. What are your girlfriends going into?" End quote. Tilda got a nursing degree at the local university and then signed on with a staffing service. She was moved hospital to hospital providing basic nursing care. She had not done terribly well academically at the university and found that when she was thrown into actual nursing work, she was faring even worse. She often wondered what she had gotten herself into and why school hadn't prepared her for the realities of life as a nurse. As she would continue to learn throughout her career, there was little that could substitute for real-world experience. So really early on, Tilda's already sort of pulling against the grain. Her family doesn't want her to go into nursing, and she's struggling at school, and then she gets out into the real world, and like so many of us, finds out that school doesn't actually teach you anything you need to know for the job that you're performing.
Yeah, so true. I mean, it doesn't teach you a lot about life too, but yeah, I could relate to what she was dealing with her parents, though. I mean, sometimes we all make those life decisions that we really have to just stick to that because we believe in them. But it turns out well for her.
Yeah, it's interesting. When you go to law school, I don't know, there's a movie called The Paper Chase. I think this thing is ancient now. I mean, it's like 70s, 80s. I mean, it's crazy. But it's a movie about law school. And when you go to law school, it's like these, when you're 1L, your first year, you go into these like classrooms and they're big and like you take this, they work at the Socratic method. It's kind of intimidating and you just learn and learn and learn that, dude, law school has nothing to do with actually practicing law. And so you get out there and when you're a first year associate, it's like this fire hose effect. You got to learn so fast on your feet and nothing you learned prepares you for it. And I've heard from others that medical school is like that when you become a doctor. And apparently, with Tilda, you read about it in the book, but nursing school is like that with nursing profession. And I know so many professions that are like that. And so it kind of makes you wonder, like, why don't they, I don't know, train you for what it's going to be like on the job? But alas, they don't. So it's just.
I think they like to just like see. It's a spectator sport from the professor's standpoint. They just like to throw you into the mix and see what happens.
Quote, "In those days of adjusting to the realities of my profession, one of the hardest things for me was waking up each morning for work." End quote. As the hours ticked by on the clock, Tilda would get more and more anxious about the coming day. Quote, "Would this be the day that would break me? I wanted to go back to sleep not because I was tired, but because I was afraid." End quote. So she was having trouble sleeping really early on. First of all, she was nervous about waking up, and then she was just nervous about her performance. And, she had all this anxiety, and she was kind of waiting for this like head-on collision to happen at work. And I think all of us go through these anxieties as we're starting a new job or starting a new career.
Oh, definitely. I think that there's one thing that you can help yourself by not doing is checking work emails before bed, because that is a bad idea if you want restful sleep, or sleep at all. And then the other thing I'll say is I always figured out that I was pretty stressed when I was like dreaming work dreams, which are like horrible. And you wake up and you like have just been in this loop of trying to solve this problem that you actually have been trying to solve at work, and you just can't get away from it.
Yeah, I definitely agree. I don't check my work email at all after a certain time at night. And I also, if I'm having a really stressed out time at work, I do not take my phone with me into the bedroom because I can't help myself. It's like I have this impulse control problem, and I'll check it anyway. So I use the bedroom as like this decompression point. And I just kind of try and relax, because otherwise I will like turn over 35 times in the middle of the night and either check it to see if I've gotten a response back. And when I was an attorney, I literally would have clients email at 1:30 in the morning. I also had a partner I worked for that was a night owl, email coming in incessantly 10:30, 11, 11:30, 12 at night. And so, it was maddening. So you have to take care of yourself, and you have to create these boundaries for yourself. And only you can kind of decide what those are. And you'll always, always have people pushing on them, and you'll always have people taking whatever they can from you. So you have to create them. Within a few years, a previous bad job market for nurses started opening up as the government changed their position on healthcare. Canada, unlike the US, has universal healthcare, but that doesn't come without its own challenges. When Tilda applied for a job at a big downtown hospital, the interviewing nurse, impressed with her 4-year nursing degree, asked her what specialty she would like. Quote, "The reputation of ICU nurses was that they were the elite squad. To work there was an achievement many nurses aspired to attain. There, the patients were the sickest of the sick, and the nurses wore serious green scrubs, which I thought might be more flattering to my fair complexion than the white or soft pastels I wore on the wards. Stethoscopes slung around their necks, and they got a lot of respect. I stared at the letters. I sounded them out in my head and found them beckoning me to take on this challenge. I'd like to work on the intensive care unit." End quote. Usually nurses were required to have at least a year of experience in one specialty area of acute care before transferring to critical care, but there was a severe nursing shortage and the hospital was desperate. They would send her on to a special course, and then she would commit to staying a year in the ICU. Quote, "The patients there have critical illnesses such as major surgeries or complicated medical problems, and we are now starting to perform lung and liver transplants. You will find it a very interesting place to work." "Good, no problem. Where do I sign up?" End quote. So you can kind of see that Tilda's this like hard charger. She finds like the most difficult place that she can possibly work, and she dives right in. She's pretty aggressive, and in her I saw a lot of me. It's like, okay, let me find the absolute most difficult thing I can possibly do, and I'm like right there.
Yeah, well, she also, just by kind of the circumstances of this shortage, she had this opportunity she really wouldn't have had otherwise until a little bit further down the road. And, we find out that she doesn't really know what she's getting into, but, she has this kind of eager enthusiasm and probably just intrigue into being an ICU nurse. And, but do any of us really know what we're fully getting into when we kind of take these plunges? I don't think we do. Otherwise, we'd never even take a step, because we'd spend all our time trying to figure out all the possible outcomes.
Yeah, I think that some people do get stuck, right? It's this like analysis paralysis thing, where I don't want to leap before I know what I'm getting into. And then, they overanalyze it, and then they never go. So I think some of it is, you just got to leap and have faith that you'll be capable of it. But there is this little part of, there's this easy road or this medium road, and then there's this road. And Tilda kind of had this little bit of knowledge, this is going to be a harder road to hoe. But she's like, okay, I'm there. I'm going this way. And I think people who are really willing to take those risks and take those challenges, they often come with the greatest rewards, but they're harder. And they're harder for a reason. So. The ICU at this particular hospital was organized so that there was a 1-to-1 ratio of nurses to patients. No patient was ever left alone. The nurses exchanged patients every 12 hours at the change of shift. They usually did not stay with the same patient shift to shift. They rotated around the unit so that no one nurse was caring for the most difficult patient after a string of days in a row. And, quote, difficult was multi-layered. Difficult patients might have a slew of complex medical conditions that all required care. They might be transplant recipients or elderly people at the end of life. And even if the patient themselves was not difficult, maybe they had a complicated family situation. When Tilda showed up at the unit, all she had was the critical care course that the hospital had sent her to. The shock of an actual ICU was startling. Quote, for the first few weeks of my orientation to the intensive care unit, they buddied me with Frances. Only a year older than I, Frances was already an experienced ICU nurse. She was patient and didn't seem to mind taking me on. Orientation was a good word for what we did together, because disoriented is exactly what I was. The first thing she did was help me to overcome my fear. She decided that I should take full responsibility for my patient's care, and she would be there as a backup, only if I needed her. End quote. Frances and Tilda would become good friends. So here's Tilda. She arrives at the unit, and Frances kind of like takes her under her wing. And we've talked before in other podcasts about this sort of mentoring that women can do for each other. But there's also this benefit of that Frances was doing about having Tilda sort of take the reins, and Frances kind of almost becoming her shadow, rather than Frances doing the work and sort of having Tilda just watch. And I thought that was kind of awesome.
I feel it is a gift for us when we have mentors. And obviously Frances was a mentor, even though she was only a year older than Tilda, but you get the sense, because it says that she's already an experienced ICU nurse, that the depth of that year was really what kind of gave her this maturity to kind of step back and let Tilda find her way, because I imagine that's how Frances had to do it too.
Yeah, I mean, it definitely seemed like Frances was basically telling Tilda, okay, here's your push into the deep end of the pool, but I'm going to jump in with you. And so if you have trouble treading water, just grab onto me and I'll help you tread. Right. So it was so supportive, but at the same time, she wanted Tilda to learn and to know, hey, you can do this. You will be capable. You can tread by yourself. And so I think that was just pretty incredible. And it made me really think about how I mentor people. And this idea that you want them to feel capable. You don't just want to show them or tell them, right? You want them to do it for themselves.
I'm definitely in a place where with Ethan, my son, who's going to be 4 in a month, where he would very much like for me to help him, although I know perfectly well that he can dress himself because he does that for Dada every single day. But so I'm trying to draw that line of myself, trying to step back and ensure that he knows I'm there, but he needs to do it himself. And so that hits right at home right now.
Work in the ICU did not come easy for Tilda, even when she had Frances to help her. Critical care required technical expertise and the ability to understand and analyze all the interlocking components of a patient. For Tilda, being competent seems so far off. Quote, maybe if I said the words and went through the motions, that feeling of confidence of being a capable ICU nurse that I dreamt of being would follow. I'd read somewhere that Orthodox Jews advised skeptics to go through the actions of keeping kosher, lighting the candles and observing the Sabbath, even though they didn't fully yet believe. Do the deed and the faith would surely follow. But even as I performed the correct actions, so much of the complex information that I was learning in the ICU remained a bombardment of separate, concrete items. I still couldn't put the whole picture together. I tried to imagine the complicated drugs I was giving and what each one was doing. This one is contracting the heart. This one is expanding the lungs. This one is carrying the oxygen molecule, I told myself. But the images were like cartoon pictures in my head. End quote. And so Tilda's getting all this input all the time, right? And she's trying to make sense of it. And it's this kind of feeling of, fake it till you make it. But she's struggling with this idea, because she doesn't know, I think it's kind of this feeling of like, is anybody noticing I'm faking it till I make it? She's kind of uncomfortable with sitting with this thought. And I kind of get the impression she's not used to having to fake it till she makes it a little bit.
Yeah, she's kind of been thrown into this world. She probably was quite successful, like where she was, but now she's thrown into this very highly pressurized, intense environment. And, I kind of really appreciated the image that Tilda tries to create with her trying to imagine the complicated drugs. She's really trying to slow time down when it's probably just speeding by. She's trying to really convince that she knows herself what each of these drugs is supposed to be doing. And at the same time, she's probably hearing that voice that we hear at times where it's kind of like, are they going to find me out? Am I really a fraud? I was reminded of this term that I've heard, the fraud police, where the fraud police are going to come and find you out because you're not really capable of what you say you are. And that's a hard feeling to feel.
The fraud police. I love that. They haven't appeared yet, though. I've probably thought that they were going to, the fraud police, probably like almost every other day. It's true though. I mean, I think so many times, and I don't even think it's when you're new to a job. I think it happens all the time. Maybe you get a new responsibility or you're trying out a new project, or, I've got this thing going on at work right now where it's just like, I keep waiting for someone to be like, do you even know what you're doing? But I'm the only one that's working on it. And so it's like, yeah, I mean, I do know what I'm doing, but, I'm very quiet about it and I'm being very methodical. And so I'm waiting because everybody's waiting on me. So, it's very difficult sometimes, and you kind of want to keep the faith, but at the same time you're like, oh, I'm just going to just sit here and, do my thing. So.
Yeah, I was also thinking about like, what choices do you have when faking it doesn't get you as far as you need to go too? I mean, at that point, you're like, oh my gosh, I don't even know what to do. Just go to sleep, I guess, and wake up the next day hoping it'll all be better. But I think I definitely have faked it until I sort of made it. It's almost like an experimental phase in a way. You try to experiment, like, okay, if I do this, then how will someone react? But it's a pretty unsettling environment.
Oh, it's absolutely unsettling. And I think that sometimes it's like by the end of the day, if you've been faking it all day long, it's exhausting, and then you're hoping like the next day you're like, can I just fake it for maybe like 10 minutes less today? Right. So you start to take like happiness in those little victories, right? It's like, Tilda, it was these little bitty victories. It's like today, if it's this medication, and oh my goodness, tomorrow I remember what that medication did from the previous day. Right. So it's the little things. So, quote, "That's how I felt, tossed between the stopcock and the complicated world of the ICU, zooming in between drawing blood from an artery and helping to withdraw life support on someone's dying mother. You'll get the hang of it," said Francis. "You'll figure out what's big and what's small, what's urgent and what can wait. There are some nurses whose main goal is to settle the patient, make them look nice, tidy up the room so they can sit down and then read a magazine. I have a feeling you're not like one of those." End quote. And so here's Frances again, like providing support to Tilda, and she's, letting Tilda know, like, I have confidence in you. I have faith that, you're one of these nurses who's going to do a really good job. And, she's also, I think, sort of implying to Tilda a little bit, there's two types of nurses. Don't be one of those nurses that isn't, attentive, i.e. you're building your reputation very early on. Do a good job of it.
Yeah, I think she's also trying to encourage Tilda that in what can seem like a really complicated environment where there's just so much knowledge that you need medically, that she says, you'll figure out what's big and what's small, what's urgent and what can wait. And she kind of simplifies it down. And I appreciate that when someone's like, okay, look, this is really what you have to focus on right now. It's really only these 2 or 3 things. So sometimes we really need that simplicity or clarity in those moments where it can feel completely overwhelming.
You know what's funny about that though is I always hesitate a little bit with that, because it's always like, that's what you think is most important, or that's your opinion on it. And I always worry because it's like, are those really the 2 or 3 most important things? So when I become a little bit more experienced, I always step back a little bit and I think, okay, well, for them, those were the 2 most important things. But for me, maybe I look at these 3 things. So, I do appreciate that, but I also a little bit, I always kind of like to, once I'm a little bit more feet wet and I'm not, nervous that I'm missing, the heart stopping beating, I would go back a little bit and take another look. But, reputation, just to get back to that point for a minute, reputation is such a big thing. And, you hear Tilda's voice throughout the book talk a little bit about reputation, but, when you're on a nursing ward, and you're with these nurses 12 hours a day, all the time, it's not 7 days a week, but, you're with them for years and years. Your reputation's a lot of what you have. And yeah, your skill set's important, but you know what? Everybody's got a baseline skill set. But how you treat people and how you deal with crises and how you deal in the moment with the other staff, and how you deal with doctors, right? And how you deal with patients' families. Your reputation follows you around. And I think that that's true in so many different professions and in life. And, so I would just encourage everybody to kind of, just keep that in mind and think about that a little bit, so. So,
Yeah, and I think the word reputation, like, it actually kind of is really built off of character, as is kind of what you're saying, is it's built off these decisions that we make, as opposed to, we can't kind of, it's a lot harder to kind of manufacture your reputation, because I think reputation is what is left from the decisions you've made. I don't know. What do you think about that?
no, I agree. I agree with that. I mean, I think you have to be conscious when you're making decisions. Tilda talks a lot about, you heard Frances talk a little bit about settling the patient and then reading a magazine, right? But Tilda talks about the same sort of thing later down the road about nurses that really get the patient's family involved, or nurses that deal well with very irate or overly involved patients' families. Or what do you do with a patient who has no family? And then what do you treat the patient like? What do you do with a doctor who can't be bothered? What do you do with a doctor who's snarky, right? Every nurse has different ways of dealing with these people, but a nurse's reputation is built upon the way that they treat folks. So you're right. Decisions, these sort of decisions that they make, build or harm their own reputation. While Tilda was still buddy with Frances, they had a 23-year-old female patient who had ascended too quickly after a dive. Frances mentioned that she didn't have a good feeling about the patient, so she had brought a crash cart near to the patient's room. The day wore on. In the afternoon, something had drawn Frances's eye to the heart monitor. Before the alarm could even go off, Frances yelled out the patient's arrest. The room immediately flooded with other nurses who raced to get to the patient's heart beating again as Frances pulled the patient's husband against the wall to get him out of the way. Within a few minutes, a doctor arrived to direct the resuscitation efforts. They managed to bring the patient back. Tilda was sent to get medication ready that they were going to use to stabilize the patient. It took her a long time. 6 glass vials were lined up on the counter, and she struggled to crack them open. Her fingers already showed the cuts from the first shattered bottle. Frances loomed behind her. Quote, "Leave that for a minute," Frances said. "Do you want to know the first thing you do in an arrest? Take a deep breath. Then take the pulse. Your own, I mean. Then take the patient's. Do everything slowly. Don't run for anything. Don't let anything or anyone rush you. Ever." She turned to go back to the patient's room. "By the way, there's a trick to those vials. Let me show you. They break with light pressure. You can't break them if you push too hard. Easy, not hard. Light, not heavy. Slow, not fast. Relaxed, not rushed. How was I going to learn all this?" End quote. So here's Frances again with such good advice, right? Slow it down. Slow the clock down. Slow time down. Slow everything down.
Well, and I really admired Frances's clarity of mind in this instance, because as you were reading it again, even just now, like, Frances was in the moment. She was dealing with the situation, and it's almost like the moment she kind of knew the situation was under control, then she sent Tilda to go do something that could almost be not messed up, but like she could take the time to navigate her on her own, as opposed to Frances is like, "Get in here and help me resuscitate this patient." She knew it was still a teachable moment, and it's almost as if she knew Tilda was going to go and need some time to figure out the medication. And I just really admire Frances's kind of patience with Tilda this whole time. And really, she never yelled. She didn't scream. She didn't say, "You're taking too long," but she really showed a lot of grace.
Yeah, and I like 2 things about what Frances said. Again, slow the clock down. It's good advice. It's very basic advice. Tilda can apply it, not just to the resuscitation or the cardiac arrest effort, but Tilda can apply it in multiple situations. So she's giving her this very useful advice. It's not this, when in an arrest, move the paddle to the left side of the patient's chest. It's not this kind of very narrow, you're doing it wrong in this situation. It's just this nice, very helpful, useful advice. And then when Tilda's using these sort of easy, not hard, light, not heavy, slow, not fast, relaxed, not relaxed. Okay, she's learning. It's this little, you kind of hear the the little rhythm there, right, of these little dichotomies. So she's starting to learn there's a balance going on. That's, you got to do this little balancing act of all of these things. So she's starting to learn how the rhythm is working in the ICU at the same time. So both of these together, you're starting to find, okay, the ICU works in this little rhythmic way. All of these things are working together. And so you're starting to see this little, for lack of a better word, this little musical number that goes on. Soon, Tilda was finding her way around the ICU and was working on her own. Quote, "It got better. Like an actress, I memorized my lines. Like a dancer, I learned the steps. The chaotic noise of the ICU began to make sense to me. The ringing of the alarms was no longer a maddening cacophony, creating a constant state of expectation in my mind. I could differentiate between the ominous gongs of the ventilator, the melodious chimes of the IV pump, the insistent buzz of the cardiac monitor. Most importantly, when an alarm went off, I checked the patient and then the equipment." End quote. Okay, so now she's starting to find her footing.
Well, and I think that it was, Frances has really been able to kind of effectively and quickly teach her, because she knew that's what Tilda needed. I mean, there was like no time to waste with this shortage of nurses. And I really like the way Tilda writes this language in here, and I could really picture all these different sounds. It's almost as if she's creating her own language and finding her own way on how to learn in this environment for herself, which seems to be the only way that each of them can really become a great nurse.
So I have unfortunately spent a ridiculous amount of time in an ICU. It is a very strange place. So it can be extremely loud. It can also be extremely quiet. And it is this sort of cacophony of sounds. And I can't imagine working in it all the time. But you do hear, every machine does have sort of a different tonal little thing that it does. And I can imagine that if you work there, you do learn them all, because they all do sound slightly different. And I'm sure that you learn all their little intonations and, all of that stuff. So as I was reading this, I was just imagining, Tilda kind of getting all these noises down as she would, work in all these different patients' rooms.
Well, and also there was meaning for her in those sounds, and it really, I feel like it's a mark of her growth and knowledge and how far she's already become in her work.
Eventually, Tilda became one of the best nurses in the ICU. Quote, "You're a pistol, Tilda," said Frances, smiling at me, watching all this from her room. "Can you believe we raised her from a pup?" asked Laura. "Yes, and now look at the monster we've created," said Frances proudly. "A viper," said Laura, which was high praise coming from her. End quote. So Tilda's like coming into her own, right? She's got this little team at work. There's this little group of the nurses, and she's kind of joined them, and she's become one of them, and it's such a great compliment, right? So Laura is, saying she's turning into this viper, and it must have felt good for Tilda, who was so unsure of herself when she started and so nervous, to be accepted as one of the team. And I think so many of us, so many times, just we want to become one of the team, and we want that acceptance. And when it happens, that's such a highlight of a new job or a new sort of step in our life.
I can imagine that Tilda looked up to Frances and Laura too, and so you're right. It must have just meant a lot to her that she had come a long way to the point where they almost now seem like equals. It's a little bit of a turning point at this point, because she's kind of found her way. She's found her footing. She is far enough down the path that she can stand by herself and really contribute greatly to the environment.
Life is a way of creating support networks around you when you need them the most. For the nurses in the ICU, they had to create their own support network with each other. Tilda's small nursing team, who most often worked their shifts together, grew especially close. It is difficult to be an ICU nurse, you see. When you go home at the end of a shift, how do you explain to your spouse or children what you've experienced at work that day? And even if the nurses could share their day with their spouse, they knew their spouse could never really understand the emotional roller coaster that they were on, shift after shift, week after week, caring for the sickest of the sick, watching families fall apart or come together in their darkest hours, and holding the hands of dying patients. So if you can't turn to your family to support you, where do you turn? to each other. The nurses became bonded like sisters, each of them quirky in their own way, each having a different way of handling patients and families, but together they managed to get through the tough days and the tougher nights, leaning on each other for support, assistance, and even when nothing was going right, laughter. They fed each other's souls and they kept each other going. If that isn't a family, what is? Quote, more than anything, what quelled our longings, restored our souls, and satiated our appetites was the emotional and spiritual nurturance that we received from one another. It was what sustained us. We debriefed one another after an upsetting encounter with a patient. We shared the horrors of wounds we had seen, patients' discomforts that we were unsuccessful to ameliorate, and heartbreaking tragedies we had witnessed. Who else but another nurse would understand how such things felt? It was through that understanding that we derived the strength we needed to go forward. We took care of each other. We shared secrets and the intimate details of our lives with one another. We understood one another. The work we did made us open up in this way. In fact, I believe that this closeness was the very thing that fortified us to do this emotionally demanding work. End quote. And so not only did they have this concept of team at work, but they created this sort of internal support network for each other because they knew that they couldn't get that support network at home. And, you know, you read about it over and over and over in this book, but it was really that support network that kept them going. And, you know, you just wonder in this sort of very challenging situation that they were in at work, what would have happened if they hadn't have had that network?
It really seemed like a sisterhood that they describe. And it seems like it's inherently needed in this career, this strong support network. And it kind of reminded me of how people talk about the brotherhood that, of soldiers, you know, kind of it's these friendships and relationships that are unlike any other. And they seem to be born out of adversity and death and just leaning on each other for support.
Yeah, and I mean, I definitely think that there are some professions where you can't talk about it at home. And, you know, I mean, I think that there's a lot of professions that have a confidentiality issue, right? You can't take it home with you. You just can't lean on your spouse. You can't lean on a blood relative. You just have to keep it inside, or you have to talk about it with people that you can talk about it with. And in those cases, you know, if you don't let it out, if you don't have that network to talk about it with or debrief with, it'll eat you, you know, from the inside out. And, you know, maybe you don't want to talk. Maybe you're not a debriefer, or you're not a verbal processor, right? So you got to find an activity. You got to find some way to let that energy out. Because if you don't, and you allow it to eat you, it will. And it'll just destroy you from the inside out. So, you know, it's everybody, you know, has their own way of coping. And, you know, there were a couple of women that worked on the ICU floor that weren't part of this team, right? But they found their own coping mechanisms. One of the women was really into cooking, very, very into cooking, you know, and that's how she did it. Another woman was very into sports. Again, it's just, you got to find your sort of outlet to let all that energy out.
Well, and I can imagine for these nurses' families, either their spouses or their immediate family that they lived with, that for that family member, it might feel a bit like rejection if these nurses aren't sharing everything with them. But at the same time, if they realize that it's okay that the husband or the roommate or the sister can't be all things to these nurses, that's okay. But those nurses are getting, you know, a great support network because of the complement of everybody in their lives.
Even as Tilda became comfortable in the ICU, the questions of inadequacy still plagued her mind. Quote, "It wasn't only the death and the dying that made me wonder if I could be good at this work. It was the inadequacy I felt when I didn't know what I could offer patients, other than my rapidly expanding repertoire of technical skills. I was still so far from possessing the critical thinking, the intuition, and the courage of so many nurses that I admired, and not only the ones within my tight circle." End quote. Eventually, the ICU takes its toll on Tilda, and she takes a 2-week leave before returning to the unit. Quote, "It had taken me only 2 weeks away from my work to recover from that disturbing mix-up with the smoke inhalation patient, plus a residue of sadness that I couldn't seem to shake off after caring for the Sikh family and their son. During that time, I came to the paradoxical realization that I loved being a critical care nurse and wouldn't want to work anywhere else. I had worked so hard to master the skills, I couldn't give up now. How could I ever have thought otherwise? In fact, at times I even felt a little sorry for people who didn't have work as fascinating as mine." End quote. So Tilda had these problems very early on with sort of connecting emotionally with patients because she didn't feel like she had enough skills or enough sort of training to connect emotionally with them. And then there were these other times where she over connected with patients. So she had it kind of both ways. And these examples that she was giving about a mix-up with a smoke inhalation patient and then the Sikh family and their son, both were these very, very emotionally intensive experiences that she went through. And again, she was almost too emotionally connected there, but she got really attached to almost these adrenaline highs, these emotional adrenaline highs that she was on, and she needed to take a break away from work to kind of get off of these emotional adrenaline highs. But you know, she was learning as she was going, and so it's like, do you detach emotionally? Do you get invested in these adrenaline highs? You know, how does this work? So yeah, I mean, it was a challenge for her.
Well, it seemed like it was this perpetual state of balancing and drawing boundaries and just keeping yourself in check, so that you're invested enough and is supportive enough, but that you are able to kind of maintain perspective on the situation. But she clearly cared deeply for her work, which is what happens to, I imagine, any of us who are, become kind of sucked in at certain times to the point where we're just completely stressed out from it. It's almost like this love-hate relationship with work.
Yeah, and we're going to talk about it, I mean, more in a couple of minutes about this, about nurses and detaching. But yeah, I mean, she definitely personally struggled with it on and off throughout the book. And, she would have these cases that she would just get drawn into, and Ed's book talked early on, they rotated patients, so it's not like she would stay with the same patients for multiple days, but that didn't mean that she wouldn't follow their cases. Right. And sometimes they would stay with the patient, they could ask to stay with the patient. So, she'd get drawn in. They all got drawn in because, that's human nature. So it was kind of how they dealt with them afterwards that was really important. Quote, "Anyone who has spent any amount of time in the ICU readily admitted that it was the nurses who ran the place. Sure, the doctors made the diagnoses and ordered the tests and treatments, but the nurses did just about everything else." End quote. And oftentimes it was the nurse who figured out the patient's issue and who suggested the tests and the treatments to the doctor. The nurse was with the patient 12 hours a day and learned to hear slight changes in their breathing, learned to see the slightest movement in their body, learned their reactions to each medication, and what was normal and abnormal for them. The good doctors learned to rely on the nurse's opinion and to trust their judgment. It was interesting because throughout the book, it talks a lot about this relationship between the nurse and the doctor. And it made me think a lot about the relationship between a boss and an employee. And I know that, people will probably scream if they're a doctor or nurse and they're listening to this because, they're not the boss and the employee. And I understand that. But it made me think of that relationship because oftentimes the boss is not the most knowledgeable one in the room. And so you gotta listen to that employee boss, because often they know more than you do and they can be extremely helpful in a lot of situations.
Yeah, it definitely seemed that it requires nurses to be humble, but to manage up and be just really thorough in their work. But they really need to take that opportunity to just honestly inform the doctors who don't seem to be obviously there as continuously as they are.
Yeah, and I agree. I mean, they definitely, I mean, they're very humble in a lot of ways, but there's a lot of also, there are some times when you see them throughout the book kind of stepping up or stepping in when the doctor just doesn't have the information and they need to have the information. And it becomes these really awkward situations sometimes with the patient's family, because if the patient's family's in the room and, that can get a little awkward. But the nurse is there. They do know the patient better than the doctor does. And the smart doctor relies on the nurse for the information. The arrogant doctor doesn't. And, that can sadly have a lot of difference in the care that the patient receives. And, there were some doctors, it's like, do not call me at home. Do not wake me. I don't care what the problem is, and the nurses, it was difficult because the nurses had really good judgment. They would know when to call. They're not going to call the doctor in the middle of the night if it's not important, but instead of relying on that judgment, those doctors were just, lay down the law. There were other doctors that were like, yeah, you know exactly when to call me. Call me if you need me. And those patients ended up getting better care. So it was it was a really good example of this sort of boss employee relationship and yes, managing up, but also managing your employees and learning as a supervisor, your employee is not an idiot, and when you're managing them, you got to give them credit, and let them do their job, because they may be incredibly competent.
Well, and it seemed like the nurses in needing to be assertive and not passive was that's what was required of them in this fast-paced environment. Also, it's in the best interest of the doctor to kind of trust on the nurse and not undermine their relationship with the patients too, because these nurses, I imagine, are able to develop these relationships with the patients that kind of probably unearths more information that could actually help the doctor. But maybe I'm reading too much into all of that.
No, you're not. I mean, it happens multiple times in the book. I mean, it's a fascinating sort of relationship to watch, and it changes nurse to nurse, doctor to doctor, nurse to doctor. And it's just, it's like everything, right? It just, the different people create different relationships. So sometimes Tilda felt that the situations were hopeless. Quote, "It is hopeless only if you see death as a failure, if you see death as the worst possible outcome. We can do everything we are able to do to save a patient, but then we have to let go and recognize our limitations. Besides, not everyone here dies, but it's human nature to dwell on the catastrophic cases. If you focus on those things that are at the heart of nursing, comfort, dignity, nourishment, promoting well-being, you'll find that you'll alleviate some of the suffering, and you'll always have hope." End quote. So in the ICU, they only see basically catastrophic cases, and not necessarily death, but catastrophic cases. And there's all of this push and pull, and we'll talk about it in a few minutes, but just these choices of life and death, and and who's going to make the decisions. But I think focusing as a nurse working there on what you can provide, and rather than dwelling on the catastrophic ending of the cases, and instead focusing, which, as she's saying, on the heart of nursing, comfort, dignity, nourishing, well-being, and focusing on those things that you can provide. And I think that that's a good life lesson, right? It's don't focus on the negative ending, focus on what you can do, And so, yeah.
Yeah, and another way I was rewording that is almost like it's like value-driven nursing instead of outcome-driven, because they couldn't control the outcome and they didn't know what it was, but what they could control was those values of comfort and dignity and just the moment that they were living in with that patient, and they could control how they were impacting that little part of the environment and the treatment.
Yeah, exactly. Throughout the book, Tilda discusses empathy and emotional detachment, and we just discussed a little bit of that above. One of the other nurses put it this way, quote, "Patients' emotions belong to them. Your ability to be helpful to patients and their families will be impaired if you share their feelings. Fear, anxiety, anger, despair, whatever. The nursing literature on this subject calls it emotional contagion, and it's like an infectious disease itself. It's hard to stay immune to it. It's very easily spread and difficult to treat. Some nurses vaccinate themselves with emotional disconnection and apathy, both of which lead to burnout and attrition. However, on the other hand, over-identifying with the patient can prevent a nurse from functioning as a professional. The course of action I suggest is this: prevention. Take good care of yourself so that you're in a position to take care of others." End quote. Emotional involvement was never that easy, however. Quote, "Families never complained about Laura, but Laura also never attempted to forge a relationship with them. She had mastered the art of compassion without losing herself in the process. Families loved her because they knew she gave exquisite care to their loved ones, but they also knew to contain themselves in her presence. Some nurses had a natural wisdom or an acquired maturity that allowed them to give in such in a way that they didn't lose themselves. In school, they taught us how important it was to offer empathy to our patients. Sympathy was wishy-washy, sentimental. Empathy was the ability to perceive and feel another's pain. One was supposed to share a patient's lived experience of illness. What profession other than nursing was defined by this degree of emotional involvement?" End quote. So you've got all these mixed signals going in and out among the nurses and in school and management about, do we engage? Do we not engage? Is it empathy? Is it sympathy? And it's nursing itself is an emotional profession. And so at the end of the day, I think each nurse for themselves kind of has to figure out, like, how emotionally involved do I want to get with patients and their families, and what works for me and what's the balance for me.
I thought that it seems like such a fragile balance, and there's such a tension that is constant, which we've been talking about. But this these passages that we just read are just a great lesson for all of us. I feel like I learned a lot from this idea, the way she puts it, this emotional contagion. And it's so true. Like we all have been in those situations where if we react the same way this person who's flailing in front of us reacts, it's only going to, be just a harder situation to get out of or resolve or calm down or diffuse. And yet, if you envision you being the calm one, kind of the opposite of what this person is, whether if they're sad, then you're kind of appropriately encouraging, or if they're angry, you are just like steadfast and calm. And I think it really works, but it was such a good reminder for me to read through that, because it's a guidebook for how that I feel like I really need right now.
No, I definitely agree. It's totally an infectious disease. It is. It's like as soon as you jump into that little chute with them, you're gone. It's like you can't get out of it again. You're in it now, and it's like, but I feel that way at work as well. So I do a job that people are very emotional when they arrive on my doorstep. When they call me, when they email me, they're 9 times out of 10 emotionally invested in the phone call, the email, or the meeting. And so if I get in that chute with them, I'm done. Then I become emotionally involved in the email, the phone call, or the meeting, and I can't detach enough to do my professional job. And so it's being very conscious of that, and knowing that I can empathize with them, but that I need to stay sort of out of that chute. I need to keep that detachment. And it definitely is infectious. Once you start going down that road, you can't get out. So you got to just make sure that, you're staying a little bit, not aloof, but you're staying that just a little bit separated. Every day, Tilda saw heartbreaking situations, but some of the toughest to deal with emotionally were the situations where it was unclear whether the family knew the patient's wishes, and even if they did, whether they would carry them out. It is always one thing to write an advance directive, but it's a whole nother thing to implement it. When people talk in the hypothetical, it seems clear what they want for themselves, but when the time comes, their wishes may change. And for people without an advance directive, the family is often left to guess as to what they would want. Would they want to be resuscitated? Maybe, but maybe in limited situations. Would they want every means possible used to keep them alive? Would they want no medical intervention other than pain management? The decisions could be agonizing. For Tilda, watching families make these decisions was often gut-wrenching, but even worse was when she sensed or the patient tried to communicate their wishes and the family chose a different path. The nurses are involved in the family meeting with the doctor and are most often a family's primary contact to the medical team, so they become the one that the family asks for guidance. But the ICU nurses cannot make the decision for the family. Some of the nurses grow frustrated with the family and will caution them or urge them to rethink their decision or to make a decision that the nurse thinks is best for the patient. But mostly the nurses stay behind an invisible boundary line, focusing their care on the patient and carrying out the treatment plan. All I could think of when I would read these passages in the book was just the agony that these nurses must feel watching these decisions being made when they could have so easily been prevented by having these discussions between these patients and these families before they ever got in this situation. And it made me think of Susan in Until I Say Goodbye, right? And the discussion she had with her husband ahead of time to have these, to make sure that this didn't happen.
Yeah, I thought of Susan exactly. And the model that she gave us was, making those decisions early, and the outcome could be peace and maybe even leave a little bit of room for joy. And that was her whole theme. And yeah, it's just gut wrenching to kind of live through Tilda's experience, seeing these opportunities that were missed. And it's almost like I could imagine she wanted to just kind of take these families who were not, she felt like were missing these, had missed the opportunities, and shake them and put them in a time machine and get them back to where they could have made this decision and made it not easier, but at least simpler and not so incredibly weighted with all the decisions of end of life. And, this is something that Jordan and I have not discussed in detail, but we've started talking more about, and it's just something we definitely need to talk through. And it's not an easy thing to talk through, but it's something that we need to.
Yeah, I mean, I think it's one of these subjects that everybody avoids because it's awkward, and it's hard, right? But I have had in the last 7 years a lot of close family die. And so I think my family has become pretty immune to the horror and the awkwardness of these conversations. And I think a lot of them have now had these conversations. And the good news is pretty much everybody in my extended and or immediate family now knows what everybody else would want. That's the good news, right? But in listening to Tilda talk about some of these families, and Tilda can either sense from the patient or knows because she's sitting there for 12 hours what the patient wants, and the family is going against what the patient wants because they think they know more than the patient, or they think they know better than the patient. Like, come on, that's excruciating. So have the discussion with your families. Like, you don't want to be that patient and be unable to communicate with your family about what you want, and your family to make a choice you don't want. So while it may be horrible for an hour of your time to sit at a Starbucks or on your couch or wherever and have that discussion, better there than when you can't have it in the ICU, and you're put through something you don't want because your family can't understand you. And it's hard, but it's worth it. It's worth it. So have that discussion. And on that note, that's all we have for today. Thanks for listening to Tilda's story and for sharing this experience with us. You can also interact with us, follow us, and learn about upcoming episodes on our website at modernathenas.com, on our Facebook page under Modern Athenas, our Twitter at Modern Athenas, and our Instagram at the Modern Athenas Podcast. We would also appreciate if you could support our podcast by leaving us a review on iTunes or Stitcher, and also subscribing to the podcast. The end of this episode brings us to the end of Season 1 of our podcast. We are so grateful to all of you, our listeners, for being with us through these first 25 episodes. We are going to be taking a summer break as we gear up for Season 2 this fall. Season 2 will bring a slightly different twist to our podcast, and we are excited for all of you to join us on that journey. We will be actively engaged on our social media during our summer break, and we will keep you posted as to when we will be releasing episode 26, which will be our first episode of Season 2. Thank you again for listening and for subscribing to the podcast, and we'll see you this fall.